Jake MacDonald, Chapter 16, Segment 2 outline. Cognitive behavioral therapy for anxiety disorders may be supplemented with medication for increased effectiveness. Anxiolytics are drugs that relieve anxiety, sometimes informally referred to as mild tranquilizers. Benzodiazepines are common anxiolytics that affect mood by boosting the effects of GABA receptors, which normally inhibit neuronal activity throughout the cortex. A phobia is a marked, long-lasting fear of an object or a situation that is out of proportion to the real danger. However, phobias can be unlearned, and phobias are different than traditional fears, such as the ones due to fear conditioning. Systematic desensitization is the gradual exposure of a person to a feared object or situation until the person learns that there is no real danger. This is a common treatment method for phobias. An agoraphobia is an irrational fear of certain environments. Obsessive-compulsive disorder is a disorder characterized by repeated, persistent thoughts or urges that are unwanted and repetitive, ritualistic behaviors and/or mental acts which impair normal functioning. OCD also responds well to cognitive behavioral therapy. When disorders occur together, they are considered comorbid. Depression is a disorder characterized by unhappy mood, loss of interest and energy, change of appetite, difficulty in concentration, and restless agitation. Seasonal affective disorder, or SAD, is a depressive disorder diagnosed in people who report feeling transiently depressed every winter. Electroconvulsive shock therapy, or ECT, is the intentional induction of a large-scale seizure, which is often effective in the relief of depression. The monoamine hypothesis is the hypothesis that depression is caused by reduced activity of one or more monoamine transmitters, such as serotonin. Monoamine oxidase is the enzyme that normally inactivates the monoamines, including norepinephrine, dopamine, and serotonin. Tricyclics is the second generation of antidepressants, which inhibit the reuptake of monoamines, prolonging their synaptic activity. Selective serotonin reuptake inhibitors, or SSRI, is a major class of modern antidepressants. They increase availability of synaptic serotonin. Using cognitive behavioral therapy and SSRI to treat depression together is more effective than using either by itself. Personality disorders are enduring impairments in interacting with other people that cause the client significant stress. Some personality disorders resemble mild versions of more serious disorders. For example, schizotypal personality disorder is a personality disorder that may resemble schizophrenia in the sense that the client may have a very unconventional, even paranoid beliefs and eccentric behavior that makes it difficult to maintain relationships. Obsessive-compulsive personality disorder, or OCPD, is the personality disorder in which behavior and thinking is characterized by a rigidity regarding order, organization, and notions of what is right and wrong. Narcissistic personality disorder is a personality disorder characterized by a sense of self-importance requiring excessive admiration and a lack of empathy for others. Borderline personality disorder is a personality disorder characterized by emotional instability, identity disturbances, and impulsive behavior that impairs relationships with others. Avoidant personality disorder is a personality disorder characterized by social phobia or extreme sensitivity about negative comments or behaviors from others such that interpersonal contact is avoided. Antisocial personality disorder, or ASPD, is a personality disorder characterized by a pattern of disregard for other people's rights, with little evidence of remorse for harm done to others.